This is the St. Mary's of the Lake Hospital site of Providence Continuing Care Centre, located in Kingston, Ontario. It is a rehabilitation, geriatric medicine, and continuing care hospital. On the rehabilitation ward, there are 15 beds dedicated to the stroke rehabilitation service. This will be your temporary home during your rehabilitation. While the average stay is 6 weeks, the length of your stay will vary depending upon your specific needs. When you arrive, your first stop will be brief as you sign in at the admitting desk. From here, you will be taken to the Gibson 2 nursing unit, where you will be living and receiving some of your therapy. Before we go any further, here are a few words from our physiatrist, Dr. Stephen Bagg.
Welcome to the Stroke Rehabilitation Service at the Providence Continuing Care Centre, St. Mary's of the Lake Hospital. Your treatment will involve working with a number of therapists, physicians, and other healthcare professionals with expertise in stroke rehabilitation. Through your active participation as part of this treatment team, we'll work together to optimize your recovery and maximize your functional independence. We look forward to meeting you and working with you.
During your stay, you will be working with a large team of rehabilitation specialists dedicated to working with you to maximize your independence and quality of life. Your team will include staff from the following specialty areas: physiatry, physiotherapy, speech-language pathology, occupational therapy, psychology, community care, discharge planning, social work, nursing, pharmacy, spiritual care, and recreational therapy. Family members are encouraged to be active participants in your recovery. If at all possible, and barring any physical limitations, they are expected to attend therapy with you about once a week to provide assistance and support in applying what you have learned. Prior to your discharge, they can help you to prepare for any difficulties that you might encounter when you return home. Upon your arrival, the first team member that you will meet is your nurse. The nursing staff will monitor your medical stability and work closely with all other team members to optimize your recovery. When settled in your room, your nurse will perform an admission assessment and orient you to the ward. Let us take a moment now to tour the Gibson 2 nursing unit. On the floor, there are both semi-private and private rooms with shared bathing facilities. This is the nursing station located across from the elevators. Therapy schedules and recreational activity boards are posted near the nursing station to help you plan your day. During your stay, you may wish to take part in some of the recreational activities. There are showering and bathing facilities where you will have the opportunity to practice and, if required, to try out different pieces of adaptive bathing equipment. Both the nursing and occupational therapy staff will assist you with these skills. There is a kitchenette with a refrigerator and microwave oven. The kitchenette is accessible to store your favorite food and for your family to prepare a simple snack. The sunroom is a comfortable place to meet other individuals who are participating in rehabilitation therapy, to watch TV, and to relax. It is also a location for group sessions such as luncheons, education, and other recreational activities. Assessment of your abilities begins within 24 hours of your admission. The morning following your admission, you will take part in a bedside assessment. You will be working with your nurse, an occupational therapist, and physiotherapist to determine the safest and most effective way to move in and out of bed, within your room, and on the nursing unit. Progress towards independence is achieved through daily participation in therapy. For most patients, this will involve 2 to 3 hours of structured therapy time per day with a physiotherapist, an occupational therapist, and possibly a speech-language pathologist. Much of your therapy will take place on the first level of the hospital. Porters will take you from your room to each therapy session. Your participation in daily physiotherapy sessions is an important part of your progress. Physiotherapy will assess and help improve your strength, balance, mobility, and walking. Safety is an important aspect, with education and practice to help you develop your skills in a variety of environments. Let us take a moment to observe activity taking place with the physiotherapy staff. You will receive occupational therapy. The occupational therapist will help you to manage tasks such as dressing, eating, and shopping that you will need to take care of yourself. The occupational therapist will also help you with those activities that will allow you to work or enjoy your free time. Depending upon your needs, the occupational therapist may help you to learn new ways of doing things, such as dressing or cooking with one arm. They may provide activities such as increasing your strength and arm function to help you maintain or improve your abilities. The occupational therapist may also provide equipment to allow you to be more independent in your daily activities. Sometimes a stroke will affect your ability to communicate. If so, a speech-language pathologist will work with you to assess your needs and create a customized therapy program to help you better communicate with your friends and family. If your ability to swallow has been affected by the stroke, the speech-language pathologist will provide you with strategies to help you swallow safely. A dietitian will work with the physician to ensure your nutritional needs are being met. All stroke patients are seen by the psychologist for stroke education and to evaluate their mood and coping ability. Many will receive ongoing support and treatment to assist them with post-stroke adjustment. The psychologist also facilitates a stress management education and relaxation group as part of the stroke rehabilitation program. Patients are encouraged to attend these sessions. The social worker meets with each individual to discuss issues that may include finances, resource development, advocacy, powers of attorney, adjustment, and transition. They work with you and your family and liaise with community services and agencies. St. Mary's of the Lake Hospital site is a major teaching center in southeastern Ontario. Graduate and undergraduate students may participate in your care, and you may be asked to participate in a research project. Participation in a research study is voluntary and an opportunity to help yourself as well as future stroke survivors. You may have free time each day to rest, participate in recreational activities, and visit other areas of the hospital that are provided for your use and enjoyment. You may wish to browse in the gift shop, operated by our volunteer department. The gift shop has a wide variety of articles to purchase, including adaptive aids and equipment. The cafeteria is open for lunch and serves warm dishes. Generally, patient meals are served on the ward and will be brought to your room. However, arrangements can be made to have your lunch served in the cafeteria. The servery is not open for dinner, although arrangements can be made to purchase a meal ticket and receive a tray to eat in the cafeteria. The hair salon is located on the lower level. Hair appointments can be booked through the ward clerk and are booked around your therapy schedule. You are encouraged to be as independent as possible, and those who are able can do their laundry here. If you or your families are not able, our staff will be able to assist you. There are chapels for worship service, private prayer, and reflection. It will take time and effort to reach the goal of maximum independence in your everyday life. The stroke team will work with you to help you achieve your goal before you are discharged from the rehabilitation program. Team members will work with you and your family to plan for your discharge. Planning begins soon after your admission to the program and continues throughout. Our team meets weekly to discuss your progress and address any concerns related to your rehabilitation. Weekend and day passes are part of the stroke rehabilitation program. Arrangements such as family education, accessibility to your home, any equipment needed, home care services, and transportation are made well in advance of the first weekend home. These arrangements must be approved by the stroke team. You will be asked to complete a questionnaire following your weekend pass. The information obtained from this questionnaire will help your team plan for future weekends at home. Arrangements are made to make the transition from hospital to home as smooth as possible. If you are eligible and require assistance in returning home, community services may be arranged before your discharge. The community care coordinator will assist you with these arrangements. When you return home, an appointment for a follow-up visit with the physiatrist will be set up for you in approximately 6 weeks. To assist you with the transition back to the community, several support groups meet on a regular basis. The Stroke Survivors and Stroke Spousal Support Group are organized by our social workers. Members of the groups meet monthly to share experiences, increase awareness of community resources, socialize, and discuss topics of interest. To help you prepare for your transition to rehabilitation, you should bring the following items: comfortable clothing that would be easy to put on and take off, comfortable lace-up walking shoes, toiletries including shampoo, a comb or brush, a toothbrush and toothpaste, electric shaver, makeup, tissues, and so on. A wristwatch and calendar will be useful. And any of the following items that would apply: glasses, dentures, a hearing aid with spare batteries, any equipment that you were using at home prior to your admission, such as a cane, walker, or foot brace, a copy of any special diet which you've been following at home, and any medications that you were taking at home prior to your hospital admission. Please ask on your arrival about anything else, such as a television, a radio, a portable DV player, and so on, that you would like to bring to your room. We would like to thank the members of our stroke rehabilitation team and the students who helped us make this video. Special thanks go to the patients who have allowed us to watch as they go through their daily lives and activities here at the St. Mary's of the Lake Hospital site of Providence Continuing Care Center.